Hello everyone, today we are covering a very interesting topic that has come across in my practice many times within the last several years. And despite the fact that I was trained in parasitology, besides my other medical training, speaking about parasites is not my favorite topic. It's not my passion actually. So, however, we have to know what's going on in human bodies. It's very interesting, and today today our topic called Taxoplasmosis. Okay, let's start with the definition of Taxoplasmosis. Taxoplasmosis is a single cell parasite. It's called Taxoplasma gondii. So that this Taxoplasma gondii can proliferate in all human cells except erythrocytes. After the proliferation inside the human cells, unfortunately, this Taxoplasma is multiplies. So now, if the immune system is very strong, they forming cysts in our soft tissues. But however, if immune system is not very strong, then Taxoplasma deteriorates people's cells, and people start feeling the symptoms that eventually, convert the whole body into disease stage. And epidemiological researches conducted in the United States and in France show that between 3 and 70% of adults' world population is infected with Taxoplasmosis. But according to Center for Disease Control and Prevention, there are more than 60 million people are infected in USA. So I'm going to answer the most important questions about this parasite that usually people ask me the most. And so the questions are how we can become infected by these parasites, what are the health symptoms we might feel, what blood tests to run to find out if one was infected in past or infected now, and what are the best prevention we might take to prevent ourselves. And okay, let's start with the question how we can be infected by Taxoplasmosis. So for my first point, I will identify that the most of Taxoplasma is in undercooked pork, lamb, and venison. As a venison, I would emphasize more rabbits, because there was find the most of the Taxoplasma. And several years ago I was find out that why all these rabbits were removed actually from the meat departments of the grocery stores. And but some of the who sells them, they keep them strictly in the freezers. So, and this was one of the reasons that they find out Taxoplasma in rabbits. So this way, when meat and venison stays in a freezer, they are more safe to eat. They're actually safe to eat. However, many people still think that frozen meat can not be fresh. Well, my point is it's better to be safe than sorry, and if you want to eat meat without parasites, you would rather purchase meat that has been already frozen. Since under the freezing temperatures, a lot of parasites cannot survive, and when your enemies are dead, they cannot harm you. So there's some Taxoplasma was found in beef, but however not even close to compare with what was found in lamb, pork, and rabbits. So I know we have a lot of vegetarians and vegans who might might watch this video and you guys might think that, oh, this is too boring for me, I'm not eating any animal meat, so I probably gonna turn down my computer or another device. But wait a minute, I have something very interesting for you too. So for my second point, I will identify that there is a lot of another way to get infected, and one of them is to consume contaminated fruits and vegetables. There are tons of results of researches indicated that many vegetables grown in contaminated soil by Taxoplasma. You have to know and think for yourself. Many fruits and vegetables nowadays sold in a farmers markets, and this is not bad idea to buy from local farmer market. However, we have to know our local farms and not local farms, actually private farms, I would say a little bit better. We have to know what's on the mind of our farmer. It's very important, and I would say that that unfortunately we have to admit that many private little farms are still fertilizing their crops with feces, just like their ancestors did. And please don't take me wrong, I'm not against of, like I said, against of small little private farms and local farms, but as long as you know what they are doing. And yes, many private farms, they do that on a regular basis, because they think that this is most natural way to to get their crops grown better and be more ecologically clean. So for my third point, I will identify that a lot of Taxoplasma found in raw and pasteurized milk. And again, I'm not against of natural products. I shop in health food stores too for certain product, not for everything, but you have to know you have to know your like I said, your farmer. So number 4 is another way people get infected is through cleaning the cat's litter box. In cats, they called oocytes or oocytes. It's spells like OOCITES, and they multiply and reproduce in GI tract of our cats. In the case of people waste cats' fecal matters in a garden or backyard, they have to be aware that these oocytes will stay in the soil for several years. They not get killed by anything, but only in several years. Number 5, for my 5th point, I will identify that it's actually very interesting. People can also accidentally swallow and inhale the parasite while cleaning the cat's feces. And I can explain to you that later, what you have to do to prevent yourself from that. But yes, people can accidentally swallow and inhale the parasite. So now, number 6, another method of getting Taxoplasmosis is eating food that was contaminated by knives, utensils, and cutting boards. Number 7, we might drink water that has been contaminated with Taxoplasma and get infected too. Number 8, we can get it through the organ transplant or infected blood via transfusion. However, in United States, cases via blood transfusion were found very rare, and in many other countries, contamination by blood transfusion are not found at all. So this is a good news. So up to this point, I was explaining how we can get infected by Taxoplasma. So, of course, after that, there would be next question. What are the symptoms of Taxoplasmosis invasion? It's very interesting. So, the problem is that most of the cases of Taxoplasmosis in human body does not give any symptoms unless person become infected for so long that this problem becomes acute or chronic. In this case, the number one symptom would be muscle pain. So, and that a lot of people mistakenly relate this muscle pain to fibromyalgia, but however, muscle pain can be an outcome of result of chronic toxoplasmosis in soft tissue. So, second symptom is all body aches and fatigue. So in another, in another relation that a lot of people might think that this is might be chronic fatigue syndrome, and not to pay attention. But this could be a symptom of toxoplasma invasion. So third one is it's slightly elevated fever. And fever about 99.6 by Fahrenheit, and it's around 37.2 by Celsius. So this is slightly elevated fever, and if it's always in this range, and of course more, so it needs to be brought to attention. Now, number fourth symptoms is swollen lymph nodes, swollen lymph glands. So, and number five, it's a headache. It's a very common symptom. It could be in everything, many things related to headaches, but headaches is symptom number fifth. Now, symptom number six is I would relate this symptom to the most important symptom to know by women, especially by pregnant women or women. So it's miscarriages in pregnant women and inability to get pregnant. I've seen a large amount of tests of women who cannot get pregnant, or who had miscarriages one after the other one, and all of them had indicator of toxoplasma in the blood protein. So this must be very alarming for those women who wants to get pregnant or and give the birth to the healthy child. Now, seventh symptoms is giving birth to dead child, to a child with different abnormalities in brain and the other organs, like its deafness and eye impairment, physical body abnormalities, and much more. So the toxoplasma could be one of the reasons for all these birth defects in a born child. So now I have to say a couple of sentences about dogs. Unfortunately, our dogs can get toxoplasma too. I'm talking about that dogs can get toxoplasma too. However, with the dogs, you'll see the most severe and chronic outbreaks. And incubation period for dogs are 2 to 3 days, and in this time, dogs get a lot of symptoms, and such following symptoms, or some of them would be elevated fever, rapid heartbeat, the pink eye, the rapid breath, cough, pus release from nose and eye area. They refuse to eat any food, and they refuse to drink any water. And they usually get diarrhea in this period, and nausea, and might release blood in a stool. So sometimes they're losing weight and get dermatitis or eczema, but especially on the head area. So very seldom when toxoplasmosis in dog can go asymptomatic. So you probably, guys, if you see all these symptoms, it's worth to check dog for toxoplasma, and and do something about that if you want to help your dogs. Now, however, the good news that we also might get toxoplasma from our dogs, but not but not as much, not even nearly as much that we can get that for them, from our cats. So cats can, feces can actually, can contain more toxoplasma and deliver that to the air that we are breathing. So not in dogs is not that much. So the next question would be, what are the treatments? So the treatments actually, yes, the treatments exist, and here we come to most funniest part of our video, and this is what I've read on Center for Disease Control site. It says, once a diagnosis is confirmed, you and your healthcare provider can discuss whether treatment is necessary. Well, to me it's ridiculous, because if something is diagnosed that people have it, it has to be treated, you know. It doesn't have to be, discussion cannot have any place in there, so it has to be treated. So to me it sounds a little bit ridiculous, because usually I can tell you what many healthcare providers gonna say, no, you're gonna be okay and you don't need any treatment. And I can tell you exactly why they say that, because the regular family practitioner, they are not trained very well in parasitology, and of course it will be time consuming for them to learn about your problem and advise you with the right treatment. So I would say that treatment is necessary, and not to let this asymptomatic problem become acute and chronic. So it has to be treated. So now let's continue. Next, what they say on Center for Disease Control website, I just copied and paste that phrases. In an otherwise healthy person who is not pregnant, treatment usually is not needed. Well, this is what is my point. Okay, there's a also the fun part, you know. What about men? What about boys, children, elderly people, women who is not even trying to become pregnant? So we all have to suffer and stay sick, so we don't have to be treated. So I don't know about you guys, but it sounds very, very controversial to me. And if someone got this parasite, please insist to get the right treatment from your doctor. And this would be smart to your body, and smart, you know, it would be smart, you know, step to do next. So next one, what they stating that if symptoms occur, they typically go away within a few weeks to a month. Yes, and they typically gonna go away, it's true. But major of symptoms people get at the time when parasites multiply in a body or laying larvae in a body, in a human body. So usually it takes that amount of time. But should we wait until Taxoplasma gonna completely will take control of, you know, of our cells and our immune systems? Immune system eventually gonna collapse, you know. We just have to do something. So I was reading that part and thinking that this is the most ridiculous statement I've ever read on on this website, because despite the fact that I really respect Center for Disease Control and Prevention website and all authorities that actually running the articles for news there, and other blogs. So this part was kind of controversial to me. We have to take control of our health, and we have to know what to do. So that's why we have to find right specialist who knows what to do after people being infected with this problem. So does it medically treated? My another question, does it medically treated, and what kind of test must be run to determine infestation? These are the other questions I get to answer all the time, and I even was preparing that like little conspect for my clients what they have to do, because not everybody gonna remember everything, especially if the people who are not on the medical field. They we're all good in our fields, right? So yes, it medically treated, and patient has to be referred to specialist who have been trained in parasitology and immunology. So they can ask the family doctor if they can provide parasitology test for them, and if doctor will provide them with that test, so would doctor be able to set the right treatment after that. Usually this is the picture, doctor's gonna sell you very sophisticated, expensive tests. You're gonna get this test, you get result on your hand, and I know so many people who actually, after getting the results on their hands, they have like either pathology or the same thing with parasites, they are not under the treatment. So it's very, you have to ask your doctor if doctor would at least prescribe the right medicine, or if the doctor know which antibiotics would work for this particular problem. I'm not a big fan of antibiotics, but for the certain parasite we have to take very the strong the medicine prescribed by the doctor, not by going on internet and to read what might be good for me. You have to go to right specialist, and right specialist has to make a prescription for you. So I strongly recommend you to ask your doctor if some right treatment would be prescribed for you. Now, you can also buy parasitology kit that includes Taxoplasma readings, and it's a blood test. It's not a saliva test, it's not a fecal matter test, it's only a blood test. And as long as I remember, the test called immunofermented test, and this test checks specific immunoproteins that called immunoglobulins, which is produced by immune system in a response of presence in the blood of Taxoplasma gondii. So I'm going to give you a little hint here how to make your first reading, and doctor's going to probably explain to you the same way, that there are two types of immunoglobulin involved in this particular test: immunoglobulin M, like a Mary, and immunoglobulin G, good. So if the result of the blood test does not have IgM, which is immunoglobulin M, or IgG, this means that the person does not have Taxoplasmosis. So this would be good, good to know. But if the test indicates immunoglobulin M, IgM, it tells that the person has acute Taxoplasmosis. But if the test indicates IgG, it tells that the person had Taxoplasmosis in the past, and now pretty much the immune system is resistant to another invasion. So kind of, to me, it's a little bit sound like a vaccination. So if you already been infected, you cannot be reinfected again. So now, what to do to prevent, and how to prevent, to minimize the risk of infection. Definitely we all have to live on prevention nowadays. It's much more, I would say, even if it's much more cheaper than to get sick, and to pay a lot of money for insurance and stuff like that. We have to prevent on a regular basis. Every day. It's worth it. It's worth it. I've seen results in the people. It's worth it. So anyway, here are some very helpful hints and recommendation how to prevent yourself from this parasitic invasion. So and again, by numbers. If you cleaning your cat's litter box, try to put mask on your face to protect yourself from inhalation and swallowing the particles that are in the air. Also, do not forget to use gloves. That's important, because some particles can go under our nails, and whether they're long or not, it stays there. So now, clean your cat's fecal matters right away preferably within the first minute, because if it stays more than 1 minute, if it stays more than 1 minute, the way these oocytes will have no time to become dangerous. I mean, within the 1 minute, these oocytes will not be dangerous. However, since they become dangerous only when they sit in a room temperature for more than 1 minute, maybe 2 minutes, but be careful with that. Within the first minute would be a smart thing to clean the cat's litters. So now, number 3, make sure your cat is not catching any rodents. It's not safe for home pets. I've heard a lot of people saying, oh, my cat is so good, it's catching, all this mouse that goes outside. No, it's not a good idea. So now, if you're pregnant, ask other family members to clean your, cat fecal matters. Don't do it yourself. Now, number 5, do not get a new cat while you are pregnant. And actually, this is worldwide recommendations for all pregnant women. Do not get new cats. Number 6, from point of view of parasitologists, it's more beneficial to consume meat that has been frozen to -4 degree, to at least -4 degree by Fahrenheit, which means to -20 degrees by Celsius. So, and then cooked between 145 and 165 degrees, at least by Fahrenheit, or at least 63 or 74 degrees by Celsius. So always check with thermometer and stick it in the thickest part of your meat when you're cooking, and this way you would know what's the right temperature. Now, only this way all Taxoplasma cysts get killed in a soft tissue of animals. So now, now get enough of hydrochloric acid. I can't talk enough about hydrochloric acid. It's one of the most wonderful supplement, and I think I'm going to dedicate one of my video to hydrochloric acid. But however, right now I just would like to to give that information to all my clients, to all the people who are watching me, that get enough of hydrochloric acid. It's very important. Don't ever forget that our stomach has to have has to be acidic. So, and the pepsin that in hydrochloric acid is actually deadly for Taxoplasma. So we must have acidic flora in our stomach. And so in some countries it's called also, I think it's muriatic acid, but here in the United States we call it hydrochloric acid. Now, next precautions are very simple and the most effective, and a lot of people have to know about that. I see that every day that people don't, I know we all love animals, we love to pet them, but we have to have also something in mind that you have to know. So that teach your kids to wash your hands anytime especially when they touching animals, and do not encourage them to pet any animals outside, especially if you don't know this pet, especially if even the home pets, they may have, many of them, dermatological diseases, and that can be very, very contagious, especially to kids, because the kids' immune system is not very strong yet. So, and it's dangerous. It's not so safe, like I said, especially if you don't know this animal. Now, try not to sleep with your pets. I know it's a very hard part for many, many people, and try not to sleep with pets, not kiss your pets either. So, and do not share the same plate with them. It's not sanitized, it's not hygienic. And despite all of our love to pets, we have to be more rational, because we unfortunately very susceptible to pets parasites and infections. So now you can tell me that pet saliva is most sterile saliva, more sterile than human saliva. Yes, I understand that. They're possible, but still you have to know that if you would see under the microscope all microcellular particles in the form of moving maps, that what I saw, you probably would understand me and be with me more than you think. So this is under the microscope, even what's going on in the saliva and inside of our animal's body. It's not a pleasure to watch. So now I told you that, and put the gloves on when you're working outside, especially if you moved in a new house and you don't know who used to live in this house, or you knew who used to live in this house but before you, or who you don't know the people who used to live decades before. I have to tell you, and I told you already, that there's Taxoplasma stays in a backyard soil for many years, and it's alive. So that's why I would encourage you to put your gloves when you're working outside. Now, wash and peel your fruits and vegetables. Yes, many of you I know listening right now and saying she's crazy what she's talking about. There's a lot of enzymes in the skin and so on. And you know what, I was telling about that for many years to all my clients, to peel fruits and vegetables. However, just very recently, I was reading the same recommendations on Center for Disease Control news, because now it's not safe, and pretty much a lot of pesticides and herbicides goes in the skin, but another thing, it's it might be contaminated, and there's no way that you might get it out with get it away with washing that. So it would be safe. If you want to stay on the safe side, please wash it and peel it, so would be safer. Now, eat only cooked oysters, mussels and clams, and be aware that Taxoplasma washed into water. Yes, and now another thing, don't drink unpasteurized milk unless you milk your own animal. Don't drink that. It's not safe, and again, I'm not trying to talk you out of the all natural stuff. No, I'm a biggest naturalist, so my clinic is natural health clinic, but however, certain things we have to keep in mind that it's a different times now, so we have to be more we have to keep more precaution in our mind. So try just not to drink the unpasteurized milk. So now, try not to feed your animals with, especially your house animals, with raw meat, especially if that meat never was frozen before. I've heard so many times from people saying that our pets are animals and they need raw meat. However, I can tell you that our home animals, they don't live in wilderness. They're usually like couch potatoes, they're with us. So, and they do not produce the same enzymes that wild animals producing. So, and if they're gonna eat something, with like Taxoplasma, of course, they're gonna get Taxoplasma. And since they don't have these enzymes anymore, they are not be able to break down the old parasites from contaminated food. So try to feed them properly. And raw meat, it's usually for animals who are living outside, for big animals, for animals who live in the wilderness, not in the houses, and not with us. Now, and in my clinic, people ask me if colon hydrotherapy will help them to get rid of toxoplasma. Unfortunately, I'm going to tell you guys that no, colon hydrotherapy is never going to help you with toxoplasma. No, it doesn't help. But our clinic always, always can, provide you with recommendation on different natural prevention, formulas and modalities. We have superior formulas and very uncommon supplements to protect your immune system. They're all safe, they're all checked, they have the best quality control in the United States. So I'm very careful with that, who I'm dealing with, what company I work with. And so at the end of this video I can say that we all love our animals, we all love our pets, and I was making this video not to get panic attacks right away and say, oh, why do I have this animal now, it's like a problem. No, but we just have to keep ourselves more we have to have a knowledge, because if we're not gonna if we're not gonna release our invaders, if we're not gonna literally, certain types of invaders like parasites, we have to work with them, we're living with them unfortunately, but we have to know how to handle these problems. So, and whenever we know how to handle the problems, they're not so harmful for us, because we know how to keep our body under control. So this was only the purpose of this video. So just use this educational information to prevent your life with natural medicine, and ask your doctor to provide the blood test you needed, that you need once a while. It would be, it's a good idea. And keep your health on track and in your hands, and do not wait to get chronically sick, to start thinking about your health. So this is all I wanted to tell you, and I wish you to stay healthy, wealthy, happy, and thanks for watching. Bye.